And then do you want me just to, okay, do you want me just to, at 7 o'clock, which is in a minute, to start?
Maybe let's give it one more minute, and then I need to connect us into Facebook as well. So that's queued up. That should take about 30 seconds whenever we're ready to do that.
Okay, then I'll start at 7:02. How about that?
That sounds good.
Okay. I don't see Dr. Shomo.
She's trying to log in. She couldn't find the link. So
Oh, there she is. Dr. Shomo. Hi, yay.
And Jan-Michele, we are live on Facebook, so we're ready to go.
All right. Welcome everyone to the COVID-19 communityresources.com town hall meeting, powered by the Center for Closing the Health Gap. Your moderators today will be superstar Tropicana from the Wiz, and I'm Councilmember Jan-Michele Lemon Kearney. So we really, we're moving forward with COVID. We've got the vaccination out, and so, and we're going to talk about that today. We also have questions though, because it looks like there's a new surge in COVID cases, and they call them breakthrough, even though some vaccinated people are getting it. Also, the FDA has approved the Pfizer vaccination. So we're wondering if that's going to make a difference. We have a lot of questions about the Delta variant, and also about, whether or not we need boosters. So we just have a lot to talk about today. First, let me, before we get started with questions and our wonderful panelists, let me thank our tech team, John Reichel and Lauren Harden. And let me remind you that we are taping this session because we will repost it later for those who can't be here at the moment. If you're on Zoom or Facebook, feel free to go right ahead and start entering your questions in the Q&A or the chat. We will get to those. So let me introduce our wonderful, wonderful panelists. We have Dr. Lou Edje from UC Health. We have Dr. Anisa Shomo, who's the current president of the Cincinnati Medical Association. And we have Dr. Roosevelt Walker, who is the immediate past president of the Cincinnati Medical Association. And as I said, Tropicana is my co-moderator. She will be joining us in just a moment. So she's gonna jump on really soon. So, let me, panelists, thank you so much for being here. Let me give each of you, a minute or two just to make some intro remarks, and then we'll get to the questions because everybody's a little bit confused. We have a lot of questions, but let's start with you. So, Dr. Edje, why don't you start us off?
Absolutely. Thank you so much for this opportunity to help move us out of the pandemic. So I am an Associate Dean of Graduate Medical Education, which means I am responsible for helping to make sure that our 700 physicians in training in their specialties have everything they need at UC Health. I'm also looking at this pandemic from 3 different perspectives. The very first one is that this is day number 340 of being in the Moderna trial. So I got my first shot September 12th, and that was 2020. That means that I am actually going to be getting my booster, my 3rd dose coming up. Addition to that, I have lost family members, so I do understand the importance of going ahead and being protected by vaccines. And thirdly, I'm a family physician. I take care of patients of all ages and all genders in my private practice as well. So I see it from all those 3 different angles. I'm very happy to be here, and very excited to be able to answer some questions later on in the program.
Thank you so much. And we're going to ask about that booster because we're still wondering, do we even need it? But we're going to talk about that later. So next, let's have a few intro remarks from Dr. Anisa Shomo.
All right. Hi, everybody. So I'm the president of the Cincinnati Medical Association, and we have been really trying to get the word out as the Black physicians in our city here in Cincinnati, just to help with some of the myths and just kind of, for me, one of the biggest things is just trying to relate to people in a way that they can understand, why they need the vaccine and answer the questions that they have, because I feel like a lot of times people may have a lot of, we want it to be an open dialogue. So that's what we're really here for, where there's no dumb question. And we really just want to have an important conversation in the language that we speak, and bridging that gap between, doctor language and the language of our communities that we come from, so just trying to be the bridge the gap in that way, or close the health gap, as it would be as well. And then for me as well, I am also a family medicine physician, and being a family medicine physician, we have an interesting perspective in that so a lot of family medicine physicians, most family medicine physicians work in the community. We are now working in the hospitals. There are some family medicine physicians who work in hospitals, but for the most part, we are the people in the office trying to talk to people about their vaccine status and have these conversations that makes us somewhat, kind of on the ground of negotiating with people and understanding a lot more of their concerns in a different way than obviously when you're working in the ER and working in the ICU and working in the hospital. The stakes are a lot higher, and they're not necessarily as much time and that sort of thing to have these conversations. So we get to have that luxury of being in a setting where we can have the time to sit and have these conversations and address the concerns of our patients and get a lot of experience with that. So I will leave it there. Thank you for inviting me.
I love that. Knowledge is power. And, I love the fact that you said there are no stupid questions, because we want people to just, like, everything you're worried about, interested in knowing, we want you to ask, because that's what we're saying today. Let's ask the doctors. Okay, Dr. Roosevelt Walker. Now, I don't know if Dr. Walker is on or not. We were having some tech issues. I saw Dr. Alvin Crawford pop up there too. Is Dr. Crawford there? Am I just imagining that? Okay. Well, Dr. Walker, I know you're working out those tech issues. So we know you're out there and you're going to join in when you can. Let me, if you don't mind, let me get to some of the questions, because we have so many questions. Before we start talking about boosters and all that, let's just talk about where we are with COVID. And now everybody's talking about the Delta variant. What is that?
So initially in the pandemic, you started hearing names of countries to describe what the variants were. And there was a push to move away from that because we didn't want to ostracize or give certain countries or their people bad names. And so they reassigned that by the Greek alphabet. And so the initial variant that came out, so the first one after the original, was the Alpha, and then Beta, Gamma, and now Delta. So unfortunately, that's just the beginning of the Greek alphabet. And hopefully, as people get vaccinated, we won't have to go further down that alphabet.
Oh, good. Okay. So the Delta is just a relatively new variant. We've been hearing that it's more contagious. Is it more deadly? Less deadly? I mean, what's the deal with that?
So just to follow up on that, as far as it being new, that's actually the one that came out of India. So this is the B1617.2. So if you heard anything going on in India, that was Delta there, and it just spread from there. It's definitely more transmissible, and for every particle of the original virus that you'd have in your nasal passages, there are 1,000 times more. So it spread much more easily as well. Okay.
All right. So let's talk about people who have been vaccinated and are now getting the Delta variant. So I think that's what they call breakthrough cases. We're trying to figure out, what does that mean, breakthrough cases?
So breakthrough cases are basically people who have been vaccinated. So I guess to back up from there, we would have to explain that when the Moderna and Pfizer data released, so Johnson & Johnson's data was not as good as the Moderna and Pfizer. So when their data was released that they were 95% effective, I think maybe it was like 94 and 95% effective at preventing symptoms of coronavirus, then that was, the outcome that they measured: preventing symptoms, preventing hospitalizations, all that sort of thing. So that meant that there could be a 5% chance that you could develop symptomatic COVID. So they never tested for asymptomatic COVID. They never, that wasn't an endpoint. one of the biggest endpoints was just if you develop symptoms, and the biggest thing was just trying to keep people out of the hospital. So basically, that was what they found. So that meant you had a 5% chance of developing, COVID, symptomatic COVID from the previous study. Of course, there are ongoing studies to see how this Delta variant is going to hold up. And it has been holding up pretty well against the vaccine. But that's a high number. So if 5% of people who were vaccinated develop symptoms, that's still a pretty high number. But the biggest thing is we're trying to keep people out of hospitals. With the Johnson & Johnson vaccine was pretty similar to the flu vaccine. So the Johnson & Johnson numbers were more like 60%, 70% to developing symptoms, but they were very effective still at 80% and above at preventing hospitalizations. So that's the biggest thing. And that's the same thing with the flu vaccine. If we can prevent people from being hospitalized and death, those are the outcomes that we're looking for, not necessarily to keep people from not having symptoms at all. But just trying to keep the symptoms from being less severe and less consequences of those infections. And so that is evidenced by the amount of people who are in the hospital. So the last numbers that I checked, 97% of the people who were in the hospital were unvaccinated. So that means there is a small percentage of people who were hospitalized who did have a vaccine, but it's very small in comparison to the people who have not been vaccinated.
So 97, so most of the people who've been hospitalized are not vaccinated.
Are unvaccinated, yes.
Are unvaccinated. So that's 97% of the people in the hospital did not get vaccinated. Whereas there are people who've gotten the variant, but they're not hospitalized, and those tend to be the people who are vaccinated. So that still makes it's still healthier. I mean, it gives you a better chance of recovery, and your symptoms are less, and you have a better chance of really survival, right? I mean, you're not as severe. So, okay. All right. So
Jan-Michele, I believe Dr. Walker has joined by phone.
Oh, Dr. Walker, do you want to weigh in on that? Okay.
Oh, sorry.
While we're waiting for him, can I just mention from the Johnson & Johnson standpoint, I just want to make sure it's understood then that Pfizer and Moderna were tested when we didn't have Delta and some of the other ones that were out there. So, the British variant, the B.1.1.7, and some of the other ones that were out there. So when you had Johnson & Johnson, which was developed later, you had some of the more deadly type, more transmissible variants that were out there. And because of that, that is why some of the numbers were lower.
Hello.
So we don't know exactly how the numbers for Pfizer and Moderna would have been had they been tested in the face of Delta.
Right. Okay. So Dr. Walker is trying to get in here on the phone. Tropicana, welcome. She's here with us now. Dr. Walker, go right ahead.
I'm not sure that he's talking to us. He sounds like he's talking to somebody else.
Okay. All right. Well, so Diana Bailey is waiting for the answer to this question. So we're going to start talking about booster shots here. She said, if you take the booster shot, do you have to take the same vaccine as your initial shots? And then she said she had the Moderna shot. So does she need to wait until they have a booster for that vaccine, or can she take the Pfizer?
Yeah, so actually there are studies to see whether if you mix and match, what is the immunity? The immunity is still good, but we are recommending that people go ahead and get what is available, the next best that's available. Moderna did put in for full approval just today. So we are also looking for that to be available very soon for folks. J&J would be much later as far as, just getting information on whether they need a booster, but they will most likely need an additional shot as well, a second shot.
Okay, so you're saying it doesn't matter what you had the first.
It doesn't. They're recommending that you try and get the same as you had before. And we do have data to show if you do mix and match, you still get good protection.
Okay, so better to get the same thing you had, but if you can't, take what you can get, right?
That's right.
Get it. Okay, do we need the booster shot? That's another thing, because I understand that the CDC is meeting in several days, and they're going to discuss whether or not we actually need to get the booster. It sounds like your study is already geared up to give you all the booster. So what's the data there?
There are two different populations that we need to talk about here. If you remember, initially, they were just saying folks who are immunocompromised, or people who have had either solid organ transplants or stem cell transplants that was just 3% of the population that they said you need an additional vaccine. That's not called a booster. It's just to get those people's immunity up to where it should have been in the first place. So it's not a refresh like a booster
like a
would
dose
be.
3, basically like a 3-dose series instead of 2.
Exactly. It's the third
Okay.
dose to give them the best chance to even get them to what it would be equivalent to some of us who've had 2, right? So a booster is truly somebody who's been fully vaccinated at least 14 days after the second shot of the mRNA vaccines, Moderna or Pfizer. And yes, there are folks who will probably be getting that booster. And I know some who already have, who are frontline folks down the line. But the science, we need to follow the science. And if that changes over time, which science does do, then we follow the science as physicians.
Okay, I'd like Tropicana to jump in. We have a bunch of questions coming up.
Good evening,
Tropicana,
ladies.
welcome.
Hi.
We definitely have a lot of questions. Hello, Dr. Edje. Hello, Dr.
Hi.
Shomo. Wonderful to see you guys.
You too.
Nancy Martin wants to know if you're vaccinated and come in close contact with a COVID positive person, do you need to get a COVID test if you show no symptoms? And should you self-isolate and for how long?
So the answer has been no, because like we were talking about before, well, the issue is all of this is changing. So from the previous data that we had, the answer would be, if you develop symptoms, you can get tested, but if you don't have any symptoms, if you've been vaccinated, the thought would be that you would be protected. But as soon as you develop symptoms, then you obviously should go and get tested. But it's just hard because at this point, this Delta variant is so contagious that there's going to be so many exposures. It would be like I would have to get probably tested, every week if that were the case. But fortunately, I have not. I've been working this whole time in my office, seeing close to 100 patients a week. Like before, we're now doing a lot more telehealth, but before that, I was seeing 80 patients a week in person, and haven't had any symptoms, haven't had any problems. Some of the people didn't have vaccines. Some of the people did come down with COVID later. But so we've been okay. That's the biggest thing. That's the biggest reason why we want people to get vaccinated, because it definitely does decrease your risk of, getting the Delta variant or getting coronavirus at all.
Okay, thank you for that. Now, there's another question from Diana Bailey, and she said, who should get the booster shot? Is there a list of diseases? Do you need a PC provider to give you a note to get the booster?
No, probably about 4
even
weeks
available
ago.
to the public. So, yeah.
Right. So probably about 4 weeks ago, the advice was to go ahead, and if you had those specific conditions that I listed previously, you were in that 3% of people who were immunocompromised, so your immune system was not good enough to really fight things off. But that advice changed, and they're expecting that everyone will need to go ahead and get that. So we'll be looking at probably rolling that out, and September 20th is, I think, the date that people will start looking for the boosters to be available for everybody else.
Diana would also like to know, are the vaccines free of charge? And would that include the booster as well?
Absolutely.
Yeah.
Good stuff.
Yeah, I guess the biggest thing would be to say where you can get a vaccine if you need one. So there is going to be shots at the shop this weekend through the Center for Clothing and Health Gap, sponsored by, will partner with Cincinnati Health Department, so that will be available. But you can go to Walgreens, CVS, anywhere. I know Children's has them in a lot of their outpatient offices, and you see I don't have them in my office because we don't have you have to have a special freezer, or you have to have room in the freezer to be able to store them. So there's a lot of storage issues of why not you can't go to all of everybody's doctor's office to get one, because it has to be kept at a low temperature. But I know UC Health still has their 584 dose phone number that you can call. So and the Center for the Health Gap, you can call them as well, and they can help arrange you to get vaccine as well. So there's a lot of different community resources that you can use if you need a vaccine.
Did you say 584 dose? So
584 dose.
I'm sorry, say it again.
584 dose, DOSE.
DOSC, okay, 513-584-DOSC. Okay, I hadn't heard that, so thank you for that. Okay, so let's talk about Pfizer. So we heard the great news that the FDA approved Pfizer. Everything else was approved on an emergency basis. So Pfizer is officially approved. Is that affecting your patients? Are you all hearing from your patients, okay, now we're ready to get vaccinated? What's the effect there?
Yeah, so the Kaiser Family Foundation Vaccine Monitor is a group that actually goes ahead and surveys folks to keep a pulse on, you know, week by week, what are people thinking? And prior to the full FDA approval, 32%, so 32 out of 100 people who had initially said that they would not get vaccinated said they would get vaccinated if it was fully FDA approved. Has that been reflected in our real work? Yes, there have been a couple of people who have come forward who had said, that's all I needed, that's good to go. I think the biggest impact, however, with FDA approval is really giving corporations and organizations the opportunity to actually go ahead and mandate the vaccine to keep their population free from COVID and also to protect the people whom they serve.
Right.
Okay.
And I will add that too, that, you know, they were saying that probably by Monday, Moderna will probably, you know, it's going to be on the heels of Pfizer that Moderna will be FDA approved as well.
Okay, and then let me try Dr. Walker again. Dr. Walker, can you hear us? We're still trying to make sure, we're still trying to get Dr. Walker. And you know, tech issues, hey.
Yeah.
Dr. Walker? Okay, well, I know he's still working on that. I just, every now and then we'll check on him just to see if he's been able to log in. Okay, so here's another question. How can we help certain African-American communities get more vaccines, like the mobile bus service, certain incentives?
I mean, I think at this point, the Cincinnati Health Department and a lot of organizations have been trying their best to get vaccines to people. And I know that like in the Center for the Closing the Health Gap has, you know, taken vaccines to senior buildings and just trying to get them out to the community. The biggest thing is just like for most of my patients who have not gotten the vaccine, it's not an issue of availability. It's more than just the vaccine hesitancy that people have not been have been skeptical. And I think part of the thing that's been, I'm sorry, am I frozen? Did I freeze?
No.
No, okay.
Good. No,
I got an alert on my thing that said my connection was unstable. So like, oh wait.
no, you're doing fine. Yeah.
So the biggest thing is just what they are calling, so they're, you know, misinformation or disinformation. So the conversations I have with my patients about why they're not getting the vaccine is that people are just, they don't know who to believe. You know, they see all of these people who are talking all of this nonsense. A lot of it, like my friend sent me something recently where somebody was talking about how, you know, the mRNA had numbers and then included 666. And I'm like, everybody knows that DNA, which is not the same as RNA, has 4 letters. It's ATGC, you know, like that's how DNA works, the pairing. So it's just one of those things where a lot of people don't have the same kind of, they don't have the same, you know, training that we have, and they can be influenced by people who sound like they're talking important, sound like they know what they're talking about. And it can be really scary for a lot of people. So I think that that's the biggest thing, that people are like, I don't know who to believe, and not, because the biggest thing for a lot of people is like, why are these people out here talking about this? Why are they talking nonsense? Right. What is the motive? And the motive really is that people really want to sound important. They really want to have platforms that sound important, and it's dangerous. That, you know, and obviously that's why a lot of like Twitter and Facebook and Instagram has put all these alerts of like, hey, if you really want the real information, click on this link, because there's just so much. There's so many people who, you know, are just on the heels of trying to create a following or trying to whatever motive they have, but it's doing a lot of harm.
I think one thing that
I hadn't even heard that 666. That's, you know, I like every day it seems like we hear something else that's kind of way out. Tropicana again.
I think one thing that we should do if people are having questions is to go ahead and talk to a trusted individual somebody who's a physician, and try and get some real answers and have your questions written down. I was just at Hartwell School, which is just down the road from my practice, just about an hour ago, talking to parents, and there were several that were on the fence. And so my question is, what does that exactly mean? Is there anything that I can do to move you closer to a decision of saving your child from being exposed to Delta? And so we had several conversations and made some connections. I think that's important. The other thing I think is—
Well, Dr. Edje, wait a minute. What was the answer to that? What did they say you could do?
So I think, so a couple of the women who were in the reproductive age group, they were concerned about, will this affect, having children down the line? And to that question, that's a very legitimate question to ask. But your blueprint to make another Lou, for example, is stored in a safety deposit box in your cells, and that's where the DNA resides. It is not accessible to the mRNA that gets injected into your muscle. And the mRNA is just like a Snapchat message. It stays in your body just long enough for your body to go ahead and recognize what it needs to make to respond to the real thing when it comes out. So number one, that lockbox is preserved. It does not get changed. It does cross over into the placenta for pregnant women and protects the unborn and in the first 6 weeks of a neonatal life as well. And it does not affect the fertility of men either. I think that was another concern. So just answering some of those questions. And I think coming to the conversation with respect and patience, it's usually not one conversation. It's just adding to reassurances from previous and leaving a connection. If you have any additional questions, here's my telephone number. This is my card. Contact me, because we've had 400 kids die of COVID in this United States, being put on ventilators, never seeing their parents again. There are videos of people who have said, who have gotten COVID from not being vaccinated and who are saying, can I get the shot now? I wish I had gone ahead and gotten vaccinated. And people need to listen to some of those stories and see, I wish I could, but now it's too late, right? Because you're sick with COVID.
Wow. That's really hard. Dr. Walker, I think you're in now.
Can you hear me?
Yes,
Yeah.
we can. Yay, welcome.
Okay. Finally.
Welcome.
Right.
Thank you. I appreciate you being so patient with me.
Yeah.
Well, you're well worth the wait. So go right ahead. What would you like to tell us?
So I'm Roosevelt Walker. I'm an obstetrician gynecologist, and I currently am working at Tri-Health Hospital. I teach residents and medical students about obstetrics, how to take care of pregnant patients and how to perform deliveries. And thank you for inviting me to participate in the program.
Okay, thank you, Dr. Walker. So we've been talking about, while you were going through the whole login process, we've talked about booster shots, whether or not we need them, the fact that Pfizer has been officially approved by the FDA, and we've been talking about why people are still hesitant, because it sounds like folks still are, to get their vaccine. Do you have any weigh in on any of those topics?
Sure. I just got off the phone this afternoon with one of my best friends from medical school, and he told me to get the booster as soon as I can.
Really?
And I'm going to get the booster because I'm in a high-risk group, and I am immunocompromised, and I need the shot. He's an internal medicine doctor, and at the hospital where he is, he's been fighting the pandemic since it began. And they are overwhelmed by people who are sick because they didn't get the vaccination. He also is going to get a booster tomorrow because he cannot risk getting sick. So I encourage everyone to get vaccinated. And if you've been vaccinated, you need to get the booster as soon as it's available to you.
Yeah, I think that window is 8 months. So I'm long overdue since I got vaccinated back in September. So the trial's offering that to us.
Right.
So, so no one thinks we should wait for the CDC to come out and talk about whether or not we need that booster. It sounds like the medical community has decided we need to just go forward with it.
Yeah. I mean, the biggest thing for us is we are like I remember last year when COVID was like, something that people were hearing about just from, it was kind of like a distinct thing. It's always been something, and that's what I tell my patients often, like, even when the news isn't covering it, even when there's so much stuff the news doesn't cover. Like yesterday, UC Hospital sent us a text and said, our ER is closed. Do not send us any patients unless they have had a stroke, a trauma, meaning a car accident or a gunshot wound or something like that, or a burn injury. And so this is the thing that I have to, I discuss with a lot of my patients. My husband may be welding. I may have to text him and tell him not to do that. But so it's just one of those things of, if, I'm like, this is the kind of stuff that is not on the news. I said, did you get an alert that UC Hospital is not accepting any patients in the ER? And he was like, absolutely not. And so it's just one of those things that we, even like early on, we're on call and we're hearing about people dying. So we literally wrote our wills. We wrote our wills during this time last year. And so it's just like, if there's any inkling of, oh, there might be a booster, I'm going to go get it, because every day I'm still seeing patients in my office who, a lot of them are not vaccinated, who may or may not be wearing their mask like it's supposed to, because we have a policy to still wear masks. And so our lives are on the line, and we've tolerated 2 doses so far. So I'm going to go get a 3rd one as soon as I can, probably this weekend, So it's just one of those things that we really want to protect ourselves and make sure that we are fine above all, because we risk our lives every day.
Well, and can you give us an overview about where we are? When we first started this conversation last year, we were saying we want to get to herd immunity where, enough people get vaccinated. And at one point I thought I heard 70%, maybe 80%. How close are we to that? Where are we now? Are we even at 50%?
We are at 50% if folks have at least had, at least one shot. The issue about what herd immunity, what number that should be, is usually figured out by how virulent or how transmissible, how easily people can get COVID from one person to the next. And so with the Delta variant being as transmissible as it is, and if we were going fully with herd immunity, we would be looking for a much higher percentage. Initially, it had been set at 70% for July 4th. We did not make that by any means. And so I think that, the people who had said they were going to get vaccinated right up front, they got vaccinated. So we're in this sort of crew of folks who are reticent to get it, and some who will probably never, unless they're actually forced to do it. When I say forced, that is a choice that they have, but the other choice is not a good one, like possibly losing your job if your work is mandating it. And so I think there are folks who will say, okay, fine, if my work's going to require it, then I'm absolutely going to get it. But there's still a percentage there that will say, that's it, I'm leaving. And we've seen a fair number of that across the country as far as in the nurse population, unfortunately, who, just because of the pandemic itself and being on the front line and the great jobs they do, about 1/5 of nurses have backed away from their professions. And I think the concern is that as we go ahead and potentially mandate that, I know at UC Health and across the greater Cincinnati area, a lot of the healthcare systems have coalesced around requiring the vaccine to keep us and our patients safe when they come into our facilities.
Okay, great.
We have a question from Ms. Diana. She wants to know, how soon can a patient with COVID get a vaccine after catching COVID?
That would be 60 days at this point. That may change, but that's what that is currently.
2 months? 2 months you have to wait?
Mm-hmm.
Okay, and is that because you have antibodies in your system that are fighting it, or?
Right, and a lot of times, again, it's folks who have been hospitalized that are asking that question. They're like, I want to get it now. I can't do this again. I've got children at home. I can't be in the hospital. I can't be on a ventilator. I can't, all these things. But that's too late. Definitely once they've recovered, if hopefully that happens, then definitely going ahead and getting it anyway, because of course we know that getting COVID does not reliably produce any antibodies, if at all. If it does, we don't know how well. However, the vaccines themselves do produce a reliable level of antibodies in your system.
I
Okay.
have a question, if it's okay, Jan-Michele.
Oh,
Um,
yeah. Hop in.
One of
Thanks.
the things that I'm running into, and you may have already spoke on this, so please forgive me if you have. I'll go back and watch the video later. But one of the things that I'm running into with my peers who were very hesitant with getting the vaccine from the beginning, now that we are requiring or they are recommending a booster shot, or now that there has been information that you can catch COVID or that you can be fully vaccinated but still catch COVID and transmit it, they're now giving me even bigger pushback on, well, what is the point of being vaccinated if I can still catch COVID, transmit COVID, and I need a booster shot? They're giving me so much pushback. And at this point, what answers should I be giving them besides log on to COVID-19communityresources.com and check the town hall? What can I say to them when they tell me, I'm fighting a lost cause?
Right. So
I
a couple of,
was gonna say we did touch on that like kind of early on. What I said earlier was that in a lot of the trials they didn't. That's generally number one. That's not an endpoint. Like we're trying to, because it's the same with flu vaccine. But the flu vaccine, we do a flu vaccine every year, and that's the whole thing. When people say, "Oh, what if I had to get a booster vaccine?" And for us as physicians, we're like, we get a booster of the flu vaccine every year. That was never something that I was worried about. Like I was like, I will get it every year if that means that I don't have to go to work and die. So I think that for a lot of people, I think the biggest thing for a lot of people is they don't understand their risk. So as physicians, we know that we're going to work and we're seeing people who could or could not have, COVID. But I feel like so many people feel safe in their bubble. And it's like, this is very transmissible and it's very contagious and you are not safe. Like more than likely, so many people are going to get COVID, and just having any protection is going to be helpful. And the point of the vaccine, like the point when we get the flu vaccine every year, because my husband, we got the flu vaccine at the end of 19, early 2020, like February 2020, he was working in ICU. A patient coughed in his face, and which we weren't wearing masks yet. So a patient coughed in his face and he got the flu and he didn't have to be hospitalized. He didn't die from it. So the point is, if you get it, it will be less severe and it will be less life-threatening. And that's the point of it. And so that's the thing. Like, I feel like so many people just, like, for me, the most frustrating thing is that people just feel so much like they are invincible. But it's like, I see so many people. I have, 25-year-old patients that have been hospitalized. We're seeing so many young people who are being hospitalized, who are dying, who are having kidney failure, who are on chronic lung, oxygen, can't breathe, tired all the time. So I think that people are just like, well, if I get it, I'll be fine. But we as physicians know that that's not true. And just if there was more information about that, like, I feel like I'm sure there is, but this is all happening in real time. So we see it every day. We see all these people who are dealing with it every day. Every day I'm dealing with people who have chronic symptoms from having COVID. But most people don't. So they're just like, well, if I get it, I'll be fine, or people are fine. It's just like, people are not fine. There's so many chronic conditions because of COVID.
Right.
So I think also there are a couple things here. One, that there is a race divide on the response to, okay, it broke through, so therefore it's useless, therefore I'm not going to do it. There is a very low percentage of folks who are Caucasian who believe that, and the Black and Latinx communities are more likely, based on Kaiser Family Foundation data, to think that. Having said that, the one thing I think I just add to Dr. Shomo's comment is that long COVID is still an issue. We are having Alzheimer's-like related symptoms that are coming. People are not coming back to their baseline once they get out of the hospital, if they make it out. They are having deficits. And the last little thing is that I listen to NPR on a regular basis. They actually had a story by a gentleman who was a bodybuilder, very healthy, ate nutritious foods, took extremely good care of himself, definitely recommended getting the vaccine to his older, frail friends. But he was like, nope, my body's good. He took very good care of his body. And he was speaking from an ICU after being extubated, meaning that he'd just come off the ventilator. And he's having problems walking up and down stairs. And this is a man who ran miles and pumped iron and things like that. This is not unheard of. And his body was ravaged. All of the work he had done to keep himself healthy over years, decades, was for nothing because he was teaching himself how to walk again. These are real stories. They happen every single day. They're happening across the country, and particularly in the South. And when I say the South, Kentucky is the South. And that is shown on all of our maps. In fact, I deal with education of residents, so physicians who are in training in their specialties. And we just had a map out this past Monday, and it showed that Kentucky has the highest number of institutions of higher learning that are in emergency status right now with their learners, because the learners are, their education is so different than what they would have expected because there's so much COVID in their hospitals.
Wow. That's, I'm just sitting here thinking, I don't know what we're going to do to get people to understand that they have to get vaccinated. I mean, okay, I'm just so frustrated with it. So
Right. But that's what I'm saying. I mean, I feel like a lot of the people, it's kind of like people are like, well, they're not telling us the whole truth. And it's just like, it's not the thing about it is we could lie to you and tell you like, no, you don't need a booster and all this sort of thing. But we keep saying all the time, like, we are waiting for the information to come as it comes. And we keep trying to be so honest about it. Like, we are waiting, we'll see what happens. We don't know the answer. And I feel like people use that against us, like, well, they don't know anything. It's like, we're trying to be honest with you and tell you that this is all happening in real time and the information changes every day. And then you have these people who are definitively, so there are a lot of people with valid concerns about like, questions with like fertility and that sort of thing. But then there are a lot of people who are just talking about like, well, I heard that it makes you magnetic and I heard this and I heard that. And there's just all these people out there who are just spreading all these lies. And so it's just one of those things where it's just, and like I said, I don't know the motive for people who are out here trying to just go around and do harm to people by spreading lies.
Right.
But it's just, it makes it really hard for us to do our job because, all of this like circle of information, is the reason why people feel that way. But it's like, we're trying to be honest with you and tell you that this is all, like, we are getting information as it goes. We're doing the best that we can. Right now, the best that we know is that you need to get vaccinated. The vaccines are safe and effective. The hospitals are full of unvaccinated people, and that sort of thing. Like, we are giving you the information that we know. We cannot predict the future. We cannot, like, people are expecting us to predict the future, and that's not fair to us. And just because we don't know the future doesn't mean we're lying,
Right.
Jan-Michele.
Yes, sir. Go right ahead, Dr. Walker.
Yeah, this is Dr. Walker, and I just have a couple of comments that I would like to make. First of all, I think it's extremely important for Black people to understand that COVID kills us. COVID kills us more than it kills anybody else. COVID kills us just like cancer kills us more than it kills anyone else. And what you need to also understand is we have a weapon to use against cancer, against COVID. We have a vaccination that was actually developed by a Black woman. Her name is Dr. Kizzmekia Corbett. She worked alongside Dr. Fauci and the other researchers at the National Institutes of Health to develop this vaccination. A Black woman led the team that developed the vaccination that we have. Now, who can you trust more than your mother?
Right.
And she was only 34. She turned 35 during this pandemic when she discovered this. I'm just so proud of her, and she's got such an amazing future. She's moved to Harvard right now, so excellent.
So here's something else. So one comment says, we are told over and over again that people don't know why they should take the vaccine since the misinformation campaign is so strong. I don't know what we can do about this misinformation campaign and why people are still believing all of that nonsense out there. What can we do?
All we can do is keep telling the truth, telling what we know to be true.
Right.
Okay. All right.
And keep suggesting to people that that if you really want to know the truth and if you really have concerns about what you're seeing, talk to a professional about it. I think that what happens for a lot of people is what they call like doom scrolling, right? I don't know if you all have ever heard that term. So it's just like when you just work and you're like in a circle of negativity of like, oh man, the vaccine does this and oh, so it's just like a lot of people can go kind of down this like drain of negativity with all of these things that they're seeing. But instead of doing that, you can stop. And if you have concerns, talk to your doctor about it. And I think that that's the biggest thing. It's like, I think it makes people really anxious. They get really anxious and they get really worked up and they don't know what to do. But it's like, what you can do is if you have concerns, whatever those concerns are, write them down, like Dr. Edje said. Whatever you see, if you want to know if that's true or not, write it down and talk to a professional about it.
Right, that's right. Okay, now here's another question. Does anyone have any idea when the vaccine will be available for children 5 to 11? Because right now it's 12 and over, right? So is there any chance that younger children under 5 may also get vaccinated? How are we doing with that?
Absolutely. The youngest one who's in the trial right now is 8 months. And we're expecting within the next several weeks to get some indication about an EUA for Pfizer for 11 and below.
Yeah. They said that the holdup has just been the dosing. Usually children who are less than 12 are, not really starting to go through puberty. So they're trying to figure out which dose to use. So that's why it's been taking a little bit longer.
Okay.
Jan-Michele?
Yes, sir.
I saw the question from Deborah Spradley.
Oh yeah, let's read that out loud if you don't mind.
Is it possible for her to speak to us and tell us what the mixed messages are?
Well, let me read her question and then our tech team will tell us whether that's possible. I'm not really sure, but Deborah Spradley writes, there's so many mixed and different messages from healthcare providers, doctors, and the CDC, the Centers for Disease Control. She said, someone asked earlier if you should be tested and self-isolate if you've been exposed to someone with COVID, and the doctor said no, and said that she's exposed to COVID patients daily. But the caller was talking about herself, not a doctor. So most doctors would not say that there's no reason to isolate if you've been exposed to a COVID person. So, and then she concludes this by saying, talking to a healthcare professional is confusing. So she's talking about mixed messages and Dr. Walker is asking her what kinds of mixed messages, but I guess that's part of it is the information keeps changing.
Well, part of it is the question was about if you are vaccinated. So that is what the CDC recommends. The CDC recommends that if you are a vaccinated person, if you're an unvaccinated person and you've been exposed to a person with COVID and you don't have symptoms, then the recommendation is different. If you are a vaccinated person and you've been exposed to somebody who has COVID and you don't have symptoms, then the recommendation is the same. If you want to get tested and you want to isolate, that's fine. But the question is like, and I guess the question always is how was it exposure? Was it a 15-minute exposure? Was it your spouse? All these sorts of things. So it just depends. And that's why we encourage people to have conversations like one-on-one, because in general, if you ask a general question, then the answer will be a general answer. But if you ask a specific question of, well, I was exposed to my husband, we sleep in the same bed. Yes, I've been vaccinated. No, I don't have any symptoms. Then that could be a different answer.
And I should
the other thing is,
Jan,
go ahead.
Sure. Hi.
How
are you? I didn't mean to create a storm here, but I am so confused. We just had a family reunion this past couple weeks for the first time, and half of our family didn't want to have it, the other did, just because of the COVID. And during this, my daughter-in-law came down with COVID. She was in Atlanta. She lives in Atlanta. And it was such a stressful situation because they would not let her come, including me, would not let her come to the reunion. And as you know, I've got a family of 4 doctors. My brother and all his kids are doctors. So there were so many mixed messages. They're like, no, she's got COVID. We've been vaccinated, but she can't be, we're not going to let her come. I mean, why would we do that? And
Right,
we,
yeah.
we almost broke up our family because
No, but that's the recommendation. I mean, the recommendation isn't to go around purposely exposing everybody.
well, that's why I was confused
I'm
with your
glad she didn't come.
question
You don't want her to
because
come.
yeah, that's why I was confused with your question when you said, "Oh no, she shouldn't." No, you don't. There's no need to isolate. It made me think, oh, then she's
No.
okay to come.
No, the
Yeah.
question, as I understood the question, it was, if I've been, like, say, could you get like alerts on your phone and all this sort of thing? Of
Right.
like, oh, there was an exposure. So if
Right.
I get an alert on my phone that says, oh, I've been exposed to somebody, or if I've, say, for example, I've been in school, because that's the thing, like at schools, all types of places,
Right.
that, people have been like, oh, they've been exposed. The
Mhm.
recommendation is if you had an exposure like at school or anywhere like that, if you've been vaccinated, like teachers, if the teachers have kids in this class who've gotten COVID, if they've been vaccinated, they don't have to like isolate and that sort of thing. So, but if a kid has COVID or somebody has COVID, whether you've been vaccinated or not, then you should not be around anybody.
Yeah, we kicked her out. We kicked her out for sure.
Well, good, yeah.
This is also a great
That's
time
the
to
big difference there. If you've got COVID, you
Uh-huh.
need to be isolated.
Right.
You need to be
Okay, well, that's what I
No one
thought
needs to
too.
be around you
Yeah.
if you have COVID. But if you've just been exposed to someone with COVID and you've been vaccinated, I hear Dr. Shomo say that you've been exposed. You don't have COVID, but you've been exposed to somebody with COVID and you've been vaccinated, so then you don't have to isolate. Isn't that
So
right?
then I mean, that person needs to isolate if they have COVID.
Right.
The person with
Absolutely.
COVID needs to
Right.
isolate, yeah.
Gotcha.
Don't go spreading
Okay.
those COVID germs, go isolate, yeah. If you've got
Right.
The other thing that I think
Okay,
is important
thank
here
you.
as well is, is going ahead and making sure we can talk about masking just real briefly. So one study showed that we actually touch our faces 16 times an hour, and COVID lives in the nose and the mouth and the throat and that area. And so not only do masks prevent us from spitting out into the air all of this COVID if we have it, it also prevents us from touching our mouth and face and nose and everything else directly. So masking is still extremely important. And for those folks who are under age 12 and who cannot get vaccinated, a wall of masked and vaccinated individuals around them is such an important protection for them.
Okay, that's good to know.
Now, we have one more question for Dr. Edje. You were speaking earlier. We asked about when can you receive a COVID vaccine after catching COVID, and you said 60 days. The question is 2 months the same if you've already received the first dose before catching COVID and need the second dose?
Yes, it's still the same.
Okay.
Because you don't get full immunity until 14 days after the second dose for the Moderna and the Pfizer. J&J is different. It'll be 14 days after the single dose that you take. So let's say you got
do you have to
COVID.
start over, Dr. Edge? Like if you've gotten you get one shot and then you get COVID, do you start over getting 2 shots again, or do you just get one more?
You still have, no, you'll still need to go ahead and get your second shot. They'll start the whole series. Now, the fact that we have 3, we're looking for some guidance on, do you go ahead and get a full three shots to go? But at this point in time, you start brand spanking new from the time after you get COVID, right? So 60 days after you got COVID, go ahead and get your first one, which would be the second one that you've gotten, and your subsequent one to get you back.
Okay, here's a question from a future doctor, Sloan Harris, who will be a doctor in a few years. And she said, what about changes with the Delta variant? I have heard that since vaccinated people are as contagious as non-vaccinated folks with the variant, they should isolate and get tested after a 15+ minute exposure.
Yes, and this is partly why, for example, the folks who are in the ICUs and learners in particular who are sitting, or taking care of patients who have got high viral loads or a lot of COVID in their system, we really do try and limit the exposure, because the increased exposure increases the risk of infection as well. So I think Dr. Shomo touched on this very briefly in the beginning.
And let me ask you, because someone else asked us earlier, are there other variants coming? Because someone actually called my office and said, what about this Lambda variant?
Yeah, we heard about
there
the
are
Lambda.
definitely going to be other ones. The way that the longer that we have people not vaccinated, That pool of unvaccinated people is the pool in which the virus continues to circulate, and the longer it circulates, the more likely as it reproduces itself, it's going to make mistakes, and a mistake in reproduction is a new variant. I'm almost guaranteeing that there will be another new variant that comes out.
Yeah,
Well, is Lambda something that's out? Yeah, I'm sorry, Dr.
And Lambda is a real thing. Lambda we've heard about as physicians. We've heard about the Lambda variant that's on the horizons. They're already doing testing. They're already doing studies about the Lambda variant. But to Dr. Edge's point, there's Lambda, and then there's going to be mu and nu and theta and sigma and all of these things. As long as you know. And the biggest thing is, of course, we're talking about the U.S. people getting vaccinated, but we have to vaccinate the whole world. You know, we're trying to figure out how to. It's a pandemic, so you know, people move around. We fly different places, but obviously we're trying to focus on Cincinnati and the U.S. and whoever's watching this right now. Who have the power to get it, because the biggest issues in a lot of other countries is the access. So that's the biggest thing. Like with India, when this Delta variant came out, it was devastating because they didn't really have access to the vaccines. So in the US, it's been devastating as well, but at least like half the people have the vaccines. But, you know, we have the potential where, you know, not, you know, until we get everybody who's age eligible to be able to receive the vaccine, it's going to be hard to reach 100% at this exact moment. But if we can get as close to 100% as we can, at least we can, you know, get it under control in the US, and every country has to worry about itself as far as trying to get their numbers up as high as they can to close to 100%.
Right.
Jan-Michele.
Yes, Dr. Walker.
I would like to make another point. I think it's important for people to understand that the virus grows in us, and as long as the virus is actively growing, it's going to mutate and create new viruses. And again, that's why it's so important for us to become vaccinated, because if we become vaccinated, then the virus cannot grow in our bodies.
Okay, all right.
It won't mutate, and we can get control of it. So getting the vaccination is the key to winning this war.
Yes.
Okay, so we all need to wear our "We Must Save Us" shirts, and just like
the mask.
And the mask. Yes, thank you, Dr. Shomo. Our "We Must Save Us" shirts, masks. Let's just pound it in so everybody realize you've got to get that vaccination. I mean, this is just, you know, that is the answer, and we've got to make that happen. Tropicana, it looks like we're really close to the end. So I'm thinking we should ask everybody for their final comments before you close us out with Renee. So everybody, you know, this is going so fast, and you all have so much information. Why don't we start? So just, you know, you've got just a few minutes to make your final comment. Dr. Walker, since you're on the phone, let's start with you.
Get vaccinated as soon as possible. We can win this battle, and the solution is easy. It has been handed to us on a silver platter. Take it.
All right. Okay. Dr. Shomo.
So I will leave with two thoughts. Number one would be, if you have concerns, talk to your doctor about it. I know a lot of people are concerned about allergic reactions, that sort of thing. So I've been having a lot of good conversations about patients about, you know, considering Benadryl if they're worried about that, EpiPens if you have a history of allergies. So there are some things that we can do as the medical profession to help with anything like that you're worried about. Number two, you know, I'm not a religious person, but one of my colleagues who works in ICU was talking about people, you know, getting COVID and being in the ICU, and, you know, saying that they were praying for a miracle. And she's like, the miracle doesn't come, they end up dying. And she said, the miracle is a vaccine. And we have the opportunity to have that chance of that miracle. Like, this vaccine came out, you know, and the science behind it has just been amazing. And we have a chance to use that technology to be in the future in the 2000s and 2020 and take advantage of the technology that we have, and be able to take advantage of this opportunity that we have.
All right, thank you. Dr. Edje.
So two things: protect the kids. And the way you do that is make sure that your mask is part of your dress code. Don't leave home without it.
I love it. Okay, Tropicana, on to you.
Thank you guys so much for joining us on this panel and your dedicated service to our community. You guys are amazing. And I just thank you for all the life-saving information that you guys share with us on these town halls. No time left to chat too long. So thank you for joining the panel as we turn things over to the president of the Closing the Health Gap, Renee Mahaffey Harris.
Well, first of all, I want to thank Drs. Shomo, Dr. Edje, and Dr. Walker, and of course, our moderators, Tropicana and Councilmember Jan-Michele Kearney, and all of those who've joined today's conversation. We look forward to resharing this information. You know, sometimes my heart is so heavy right now because I am so concerned about the feedback that we're getting about folks who are like, you know what, I don't know. And you all have each given some very compelling, strong reasons why we must work to save us. We must mask up. We must protect our kids. We must get vaccinated. And if we have questions, ask our doctors. The Cincinnati Medical Association has been awesome. They have responded to text messages that we receive and respond line by line to whatever the questions are that people have. We want you to ask. We want to answer your questions so that you are informed to make a decision that is going to save your life and the life of your family members. So all I can say now is join the Center for Closing the Health Gap, the Urban League, the African American Chamber of Commerce, the NAACP, the Cincinnati Medical Association, our Cincinnati Health Department, Hamilton County Health Departments, by working together to save us and get the vaccine and get your questions answered if you are not sure. Thank you all this evening, and we look forward to sharing this information with everyone.
Let's all say it together. We must save us.
We must save us.
You must save us.
Bye, everybody.
Have a wonderful evening.
Thank you.
Good night.
Everybody.
Bye.